faces. Maybe I should say familiar faces. New faces. I think I've got the only old face. I'm actually going to go through the framework we discussed the last meeting. Today, I'm going to go through this framework that I've cobbled together based on a lot of historical information and all of your contributions to the group over the last few years. But before we do that, I want to welcome everyone. If you've been here before, welcome back. If you haven't been here yet, this is the first time, we welcome you. I think we'll just go around because there's some new names and faces, and just kind of say a word about yourself. I'm Susan Summers and I work for Arch. I have a background in early childhood special education and I directed a crisis nursery respite program in the 80s. That's how I became interested in respite and had a career in academics, and then joined Jill about 5 or 6 years ago doing some evaluation, and I've never left. She can't get rid of me. I'm here.
Thank goodness.
So that's me. Let's see, Jennifer, do you want to say hello to us? And
sure. Good morning. I'm Jennifer Hill with Oklahoma Human Services. I'm with the Lifespan Respite Grant Program.
Hi, Jennifer. And I've got Abby on my screen next.
Hi, everyone. This is Abby Daraponsany. I work at the New York State Office for the Aging.
Hi, Abby. And let's see here. Melissa.
Hi, everyone. I am Melissa Price with South Carolina Respite Coalition. Good to see you today.
Yeah, good to see you too. I think, Melissa, last month was your first one and she just dove in. She was great. So I'm glad you're back. And is Anne Marie?
Yes, hello. Good morning for some of you. I think good afternoon for some of you. I am new to the Nevada Lifespan Respite group, so I'm just starting to get my feet underneath me. So just wanted to join in and learn everything I can.
Oh, welcome. I'm glad you're here.
Thanks.
And Corey?
Hi, I'm Corey with the Helping Hands of Vegas Valley and the Nevada Lifespan Care Coalition.
Thanks, Corey. And Nadine.
Hello, everybody. Nadine from Oklahoma Human Services, Lifespan Respite Grant, Caregiver Coalition. Come join our Caregiver Conference November 1st. It's virtually. Go to okcares.org and connect there. Jennifer Hill, I'm on a team with her, and then Aida Stevens, just so you can connect us all. We subcontract with Aida to do the Lifespan Respite Voucher Program. Aida, you can introduce from there.
Thanks, Nadine.
Hi, everyone. Happy to be here. Aida Stevens, and just so thrilled I got to meet several of you in person. As Nadine said, we're the subcontract for Lifespan Respite Vouchers. We're also executive council of the coalition, and I'm also a family caregiver, and many of our team members are family caregivers, and just happy to be here.
Glad to have you here. And let's see, Doris and Dina.
Good morning.
Good morning.
How are you? I'm with the New York State Caregiving and Respite Coalition, and you all know me.
Yeah, I saw you smattered all over Facebook, having a great time.
No, I didn't have any fun at all.
It was good to see you from afar.
We miss Dina, so I'll segue.
Hi, everybody. Dina Preston with the New York State Office for the Aging. Yes, I missed all of you. I was bummed that I was not there, but it looked like you had a great time and it was a great conference.
And let's see, who did I have missed? I missed Claire.
Hi, everyone. I'm Claire. I'm a graduate student intern at the New York State Office of Aging.
Welcome again, Claire. You were here last time. Have I missed anyone? Abby? Melissa, did I get you already? Okay, I think that's it. So I'm going to show you just a quick slideshow that I've put together based upon the very beginning work of this group, which for those of you who are new, about 5 or 6 years ago, there were actually sustainability planning grants. The number of states had them. And their job was to, in real time, develop a sustainability for their plan. And when I came on board Arch, my job was to evaluate that project. And coming out of that project, a group of the leaders of those projects got together to talk about how they could make information about sustainability accessible to the whole network. And so this group came out of that. And in this group, we've had some real-time planning from states and a lot of just practical application of sustainability principles. And each month we come together, kind of give a report in on what we're doing and how that relates to sustainability and strengthens the respite system within states. So I've gone back through my archives and tried to pull this information together in a way that we might use to build a framework that we might use to demystify sustainability. It's the topic that most grantees want to have more information about. And my personal observation is the topic that most grantees are least willing to actually engage in the planning. It's very daunting. So I'd like to make it less daunting, more accessible. So that's the idea behind this plan. One of the things that we've learned about the original toolkit for planning is that it doesn't quite capture the kind of dynamic process of it and the social relationships necessary for it. And so it's sort of the plan without all the kind of wisdom and knowledge that you get from planning, sort of divorced from that. So I tried to bring that in. So without further ado, I'm just going to put the framework up on my screen. Can I do that just now? Jill, will you share screen with me? Hold on, let me clean up my, and then I'm absolutely terrible at this stuff. So you all tell me if can you see my screen? Okay, Jill, what do I need to do? Do I need to?
Do you see share screen at the bottom? Did you click on that?
Yes, I do. Okay, there we go. Okay, and here we go. And one more thing.
Click on slideshow. Yeah.
Got it. Okay, there we go.
go.
Okay, so the first thing you'll notice is that in addition to sustaining, I've added creating, repairing, and reviving, because one of the things that we've observed is even the strongest states may lose leaders, have a change in governance, lose major funding, and have to rebuild. So to me, that's kind of part of the sustainability story. And the second thing is, and now all your names, the new members will be added to this. All of this knowledge comes from all of you, from the original evaluation, learning from those original states. And so there isn't a textbook we can go to. There isn't a single person. It's our collective knowledge that I'm trying to make visible and accessible to others. So one thing I want to say is huge thank you to all of you who have really dedicated a lot of time within your states to sustainability planning, but also been so generous in this group. This is an amazing group of people who share generously in these meetings, but also connect outside the meetings to support one another. It's the best I've seen in collegial behavior. So, okay, so this is the way that I've been thinking about it. Typically, we've talked about just the plan, writing the plan, getting people together. But the things that I think that I see as essential are these additional 6 elements that interact with the plan and support the planning. And the first one of those I see as leadership, and this is demonstrated a lot in this group. You'll notice if you're new that in this group there are a lot of team members, and not just like one person from a state. And I think that's key, that you work as a group and you work as colleagues and friends. You'll see later in this slideshow, I've come to think that friendship is just a major thing in sustainability planning and any kind of planning. And I just came across an article in the New York Times like a few days ago that talks about how to keep employees. And the number one thing then contributing to retention of employees is friendship in the workplace. So it's something to think about. Have a good time while you're doing this. So things that we've talked about and observed, I've observed among all you, are recruiting leaders, mentoring leaders, supporting leaders, sharing leadership, building teams, and succession planning. And you can just see among you right now, we have New York and Oklahoma both have, when they get new members to their staff, they bring them on at this planning level, and just sort of start to mentor and you see, and I've just observed in both states, these two states come to mind because I think they have the longest relationship with the group. So I've seen this firsthand. I've just seen this enormous blossoming and growth among members and cross-fertilization and excitement. So I think that's really important. Don't try and do this alone. The other thing that we learned from that original evaluation is what sometimes we'll see one strong charismatic leader. And so it looks like the whole state system is strong. And when that leader leaves, the system kind of crumbles without that leadership. So really important to, I think, to do these. Now, these are the foundations. The second foundation, is collaborative partnerships. And you can also see this in Oklahoma, right now at this meeting, how you look across offices and systems and form strong partnerships so that, again, when one piece of it goes because of change, there still exists a system, something to rebuild. Just if you'll note on the red ampersand, not ampersand, but the red notation on state coalitions, the grantees identified state coalitions as a top priority when they were surveyed. So just kind of historically, this has been the thing. But I'm gonna, at the end of this slide presentation, I'm gonna ask you about what expertise we have within this group that we could share maybe through webinars or some other format with the group. So as you see these, as you view these slides, think about what you're strong at and what you might want to share with other people. Okay, so those are the two foundations. This is the plan, and this is where the focus has always been. But again, I think you have to kind of go back to these other pieces to really have this make sense. So most people will start with a needs assessment and resource assessment. And then this has not been explicitly stated anywhere, but this idea came out both out of my own research background. I used to do and teach research at University of Washington. And through a conversation that I had with Dina Prest, when they were doing their planning and writing up their plan, and Dina and Doris were presenting the plan to this group, Dina and I talked about that, the plan being one thing that didn't quite capture sort of everything that went on. It's a marker, but there's so much more that goes on in planning. And so the notion that it's iterative means that you keep having to go back to get closer to what you end up with. And I think, Doris, you were the one that organized these meetings. You organized a number of meetings. So you weren't done with the first meeting. This was the jumping off point. So if it were easy to write a plan, you would just hire somebody to write a plan, right? But what the plan represents is this give and take, back and forth, individual contributions, thoughts, until you refine and refine. And that's what the recursive process means. You keep circling back to the original and making a little bit better, a little bit more understandable. You start coming up with solutions. You start coming up with novel ideas that relate to the purpose. So the plan itself, you identify and clarify your vision. You identify what you wish to sustain, you do logic modeling, and then you facilitate and write and revise the plan. So the notion is that the plan's a living document. And this is, New York's the only state that has done the whole planning process using the toolkit. But those of you who haven't been with this group, one thing the group has observed about New York is that they just, they're so fertile right now. They just have idea after idea after idea that they're envisioning and implementing through these partnerships. And I'm guessing that the planning process really helped fertilize that. And Doris kind of talked to that last time we met in August, and that's a really worthwhile recording to listen to if you want to see that in action. So that's the plan. And again, this is what we used to just talk about, the plan without these other parts. And then I see 4 different elements of the plan. The first one, diversified and leveraged resources. And again, going back to the very beginning when we were talking about forming the Sustainability Learning Collaborative Group and what was needed in the network in its entirety, and based on surveys with all grantees, volunteer and faith-based model respite service models were identified as their top priority. And then a group has grown out of that, which is a really strong learning collaborative. But I also identified these other elements that I think are important based on all the work that Arch has done in summarizing all of your work, all your grantees work, multiple funding sources, shared time, space, personnel, material. This one is my pet, innovative and exemplary programs and services. I think this is kind of an untapped resource because we have these in our states. They're not reliant on state money usually, or grantee lifespan respite money. They're more sort of locally funded, but they're absolutely inspiring and a real resource in terms of knowledge sharing, inspiring other programs to start like programs, informing when we do discretionary grants, informing what elements should be in those. So I added those as a resource, local funding initiatives and permanent funding sources. And then another element supporting the plan, workforce recruitment, training, and support. So using evidence-based or informed standards, innovative and exemplary practices, core competencies, training initiatives, models of recruitment, matching, supervision, and support, and college and university-based programs. And again, we're starting to see these in force among individual grantees, but probably not as a whole network. And then we talked about this in the last meeting, outreach, education, and advocacy. So clear and effective messaging for multiple audiences, outreach and access, technology outreach. I think of as one example would be a single access point, like many of you have through state websites. And then outreach and access, human reach, navigation, and warm handoffs. I think of Tracy Sinowitz when this one comes up, because they're so good at walking people through navigation. Actually, New York is too. So the more human part of outreach and education and advocacy. And then data that show the progress, merits, and cost benefits of respite programs and services, targeted white papers and policy initiatives, legislative change, and strengthening advocacy network. And I haven't seen this used in respite, but I participated in this when I was in the disability community, partners in policy making, and that might be something that we want to look at in respite. And one of the things that I want you to think about is how each of these things informs the plan, and how the plan in each of these things informs outreach, education, and advocacy. You can't really effectively advocate if you don't have strong programs and strong data to advocate with. You have to know what's going on. And so these were my takeaways, that the plan isn't this kind of like dead thing that you write up and put away. It's a living guide. It should be inspiring, and it's a marker of a place and time. And that before you can plan, you have to make friends within and outside your organization. And with those friends, plan on doing something meaningful, useful, and gratifying to all involved. And it should be on its face, really meaningful, and the use should be apparent. And then among those friends, make sure caregivers fully belong and participate. And Oklahoma just talked about how many on your staff are caregivers and many in this group are caregivers or have been. And I think that's key. And then also to look for the outside voice that can't easily participate in the professional part of respite, but can advocate because of their experience. Like, how do you recruit and support caregivers by giving them respite, paying for transportation, whatever, so they can really be involved, like in coalitions or planning groups. Be organized and transparent. And as you plan and do meaningful and useful work, keep track of what you do and share what you learn. And then keep circling back to make adjustments to your plan and to your work and to celebrate your accomplishments. So those were just my observations, juggling as all of you, keeping all those balls in the air. So here are the questions I have for you. Did I miss anything? Does the framework make sense? Does it ring true to your experience? Do I have things in there that don't belong? Did I miss things that do belong? So just the framework itself, does it make sense as a way to share information with the larger network? And does it make sense standing alone? And just unmute and jump in.
Well, I think it's great. And I think that adding that human touch and what all those connections are is huge, because none of us would be able to do anything without each other. So that is something that was missing from the original toolkit. It was very, I don't know what I want to say, dry, academic. I mean, you know, just, which is why I thought a facilitator was really helpful for us to kind of drill down. But, you know, our facilitators become our friend as well. So, and we circle back every year with our whole core team and look at the last sustainability plan and mark where we are in the new year.
Yeah.
So I think that's great.
So what would you say, Doris and Dina and Abby, to make people less afraid to jump into planning, less reticent about it? Maybe that afraid is not, maybe not the right word, but because it's daunting, right? It's a big thing.
Daunting. For me, I never would have gotten through it. I sat and read through it and went, holy cow, there's no way I can't even, I mean, there's so many resources and tools in there. It's hard to look at it as a whole thing and think, oh, I could do that. But when we handed it over to our evaluator and our facilitator for sustainability planning, he really pulled out the main things and facilitated that discussion. So I think for me, what was most important is that he knew the right questions to ask us to really get to the meat of how we were feeling. I mean, I remember the very first meeting, Dina, I don't know if you remember, but we hadn't even really settled on what we were there to sustain, right? So there was a lot of discussion around, are we sustaining the entire lifespan respite grant, or are we sustaining the coalition? And I just remember saying, you know, not for nothing, but if the lifespan respite money goes away, the New York State Office for Aging will survive and they will continue to do their work. For me, the most vulnerable piece of the lifespan respite grant is the coalition, right? So, and I think quite honestly, I think the New York State Office for Aging would continue to support us, at least to some degree. But for me, that was the big takeaway in the beginning. We didn't even know when we came into that room what we were there to talk about to sustain. Yeah. There was not agreement at that point.
I was going to say to you, I'll never forget that meeting, actually, because as much as like we feel like we do a really great job in meeting frequently, you know, having, you know, conversations around, you know, what we're working on, any adjustments that need to be made. But yet when we took that toolkit, and before I think we even engaged Tom to be our facilitator and actually have like annual retreats to, you know, to work on sustainability, that initial step of the self-assessment tool, that was what Doris is speaking about, where the coalition, answered those questions, and then the state office answered those questions collaboratively. And then we came together and reviewed our answers, and we couldn't believe how far off we were on many of those questions, which was really kind of eye-opening, because if anyone asked us that, we would have never thought that we were so different in our thinking about it, So yeah, that was a pretty eye-opening moment. And it actually, I think, even just reinforced, the thinking around and the need for us to make sure that we included this planning each and every year, so that we didn't have this happen again, right? Where we were really thinking about things from such a different perspective. So
yeah, so that was a really important step, because the toolkit we've kind of gotten away from in this group, because it is so daunting. It's hard for most states to commit to the process. But that's a step you wouldn't want to leave out, because it sounds like, because it really opens your eyes to what you're actually dealing with. It makes me think about the collaborative evaluation that Leanne Winchester in Massachusetts talked about. I mean, it's different, but Massachusetts was rebuilding, and they had to kind of go back to all these partners. Some had a history and some didn't, and get them to recommit. And you all had the commitment, but we're still far apart in your thinking. So that, it seems like you wouldn't want to gloss over that, that you'd want to kind of dig into that.
There was another daunting piece for me, because I put together, using one of the, who's in your coalition kind of, there's a sheet in there, and it lists every disability agency and everything that you could ever think of. And it asks you to try and figure out where the holes are, right? Well, the holes were gaping. I put together a survey monkey. I sent it out to all the advisory board members, and I just, when I got the results back, I was just like, oh my God, we'll never get there. I can't even believe that I have to take this on. It's crazy, but we did. And, we still have holes, but we don't have gaping holes. Right. And that's also a living, breathing thing, right? People come and go. But even that little piece just made me just go, oh, I can't do this.
Yeah. But you did it. So
I did it, and I realized just how much work there was to do. And that's the daunting piece, right? When you look at it as the big picture, it's overwhelming to think, because we're just putting out fires all the time, right? It's not. So looking at it from the sustainability perspective, at least tells you which fire to put out first.
So, but how does that feel now? Like, looking back, now it's been a few years. Do you feel stronger and more able to identify and put out fires?
I think not only that's true, but our partnership together has grown over the years, right? We still have the same core team. Oh, we are missing our fearless leader, Jennifer Rosenbaum, who retired, but things always change, and it's leadership at the top that so. But I think Dina, I think Dina thinks we're stronger, but if not, we'll have a bottle of wine and talk about it.
That always helps when we do get together in person. And I always feel like when, and Jennifer actually would always say this to me, like, whenever we felt like Doris and I were, at a crossroads, or feeling like we weren't seeing eye to eye on something, like Jen would be like, I think you need a trip out there. You need to go hang out in person. Like, because it does make a difference when you're able to kind of sit down, block everything else out, and really just have, like, a heart to heart about something. But I personally think that setting up these retreats, whether you can have a paid facilitator or not, is critical, because we are so busy. We're juggling so many balls every day. I know for Abby and I don't know that we could carve the time out unless we forced ourselves to, with a calendar date, right? And actually go in a meeting room, shut the door, everything else is shut off, and you focus and plan that whole entire day. And I think at the beginning we did to a day and a half. We've now gotten it down to a day. I think when we were going through the toolkit, we felt like we needed a day and a half for like the modules. But like now that we're just, you know, working from there and kind of updating our plan each year, a day seems to be sufficient. But it is a little overwhelming when you leave the room because you were talking and thinking so much, you're drained, but you're also jazzed. It remotivates you. You feel clear about the direction. You know, you can't wait to get out there and like, you know, start to work on the things that, you know, you discussed. So.
And I'm going to just advocate to anyone thinking about doing the planning to find the money for a facilitator, because maybe it can be done, but you, Dina, you, Doris, Abby, your core team wouldn't be able to contribute in the same way. I mean, you have a lot invested in a lot of knowledge and wisdom about respite. And if you're the ones facilitating, you don't get to offer freely like you would. And you're already really busy. Hand that piece over to somebody who.
I think it also levels the playing field, right? If you don't have somebody in your partnership who probably is your grantee or your grantor, right? So they are ultimately the power piece, at least in the beginning, right, of a coalition. So if you have them facilitating it, they're more likely to start where they're thinking, not where I'm thinking, right? So a neutral third party to me was the most effective way to go about not only identifying that we were miles apart, but that we could come together.
Right. Yeah, that's a good observation.
And I think people just need to be patient because I mean, you know, it took Doris and I a little while, a good probably year where like we got to know each other and you build trust and rapport and you know, that the other has your best interests, you know, in mind, that, and like, that just takes time. That's not something that's just going to be like immediate, you know?
And I think the person to person thing, I was thinking back to a time when I had the job as associate director of a USED, a university, you know, based program for people with disabilities. And one of our missions was to do community outreach, but we had this real ivory tower reputation that we didn't have like a great reputation in the state. So when I got that job, I started driving from Seattle to Olympia. I just like would kind of cold call the leaders of every agency or department and agency that had to do with disability and set up a meeting and sit in their office and make nice, you know, for an hour. So, and by, you know, after some time, I started having brown bag luncheons that were really well attended at the university, and I'd have the head of a different agency come and talk about what was going on in real life, you know, to make us less ivory tower, to make our work more relevant. And it was daunting, but it was pretty simple. They're people, they want to do a good job. You know, we all have something to offer one another. So, and it took time, it took some years, but it's a really good feeling, yeah, to make friends. And I think like, Doris, you were saying people come and go, but I think once you've got this strong core group, it's like people want to belong to that because they see you're productive and having fun and like one another. And so, yeah, so the human part was useful. What else in that framework? What do you all think you're good at that you would like to, and or what are you not good at that you would like to learn more about? If we did a series of webinars, what does this group have to offer to the network? Want me to go back to let's see if I can go back to that model. Leadership collaboration. The last meeting we talked about, we really needed a webinar on advocacy, legislative advocacy. Are there things that stand out in this? Any wisdom you could impart?
Well,
personally?
wisdom I'm seeking maybe is a better maybe thought. I know some states have secured legislative line items, budget line items
Mhm.
to fund respite. We have successfully acquired other grants because of Lifespan. So those partnerships truly have helped us enhance. But, you know, getting knowledge and wisdom from those states that have secured those line item budget and really digging in on the details of what that involved, because, and Nadine, I don't know if you want to add anything to this. We're doing great in terms of collaborating across multiple statewide respite voucher programs, but I think if we talk to each of them, that is definitely an area we need to improve upon. And I know it would definitely help with sustainability. Nadine, do you want to add to that?
Mhm.
Yeah, we do struggle with that here in Oklahoma because I, as a state employee, I can't talk to legislators.
Mhm.
My hands are off. And Aida's kind of, we all have to tippy toe around that. That's tough. We have a coalition, you know, lots and lots of members, but a lot of them are in the same boat. So
Mhm.
we have to be very, very careful on how we approach that. As far as collaborations, you know, we have, you know, a frustration I have here in Oklahoma is that we've got great voucher programs, 10 of them, different voucher programs, foster care, post adoptions, VA, and we're really, really tight. We know how to refer to each other. They can't advocate either. They're state funded, but we all work really, really close together. And what I continue to preach to them is we all need to be collecting data together so we can go as a whole to our legislators, get people behind us. And we've got those people, but our voucher programs, I mean, this is going to come off bad, but I'm not meaning it bad. You know, we're kind of forced to get data as lifespan respite grantees, which is a good thing. These state funded programs don't necessarily have to provide any data. So it's hard for me to get my arms around showing our legislators what we truly are doing in Oklahoma, because I can't get the other programs to collect data. So again, that may not be a lot of other states' problem, but that advocacy part, we really struggle on. I mean, they're hearing us, they're seeing us because we're making enough noise through our outreach efforts. And because also I oversee 9 grants that are ACL connected in some ways and help family caregivers. So I am always talking, all of my staff across all the grants are talking about each one of their programs. So I feel like that really helps us to get with that outreach, that advocacy. That's the part that I just need to get the other the other respite grantees to understand the importance of data collection. And we're working on that. We're getting ready to do the first of the year, our sustainability plan, reviewing that too. And that's one of the things I really want to get everybody on the table, that we need that. So
Yeah.
I don't know if I went off in a tangent that you don't want to hear about.
No, I think this would be such a good webinar. Maybe like a panel with Oklahoma and Alabama and South Carolina, maybe the different, you know, like people can just, the network could hear you kind of identify what these issues are, the ones you've been able to address and the things that you have to, you know, that you're chewing on and things that have been successful. Because this is relevant to everybody. I think it's really important.
And what I want to add, Susan, is, you know, 10, 12 years ago, 13, I've lost track. Whenever I looked at that first, that sustainability plan, I'm like, oh no. To be honest with you, after the first meeting, I set it aside and I thought, I'm gonna figure this out.
Yeah.
It was too much for me.
Yeah.
So I put myself in those shoes of those individuals. I like this breakdown. I mean, I'm not sure where you're taking this, but even if a group of us revisit that and rework that, that have lived it, you know, gone through it and realize what works, and telling them year 1, do this, year 2, do this, something like that, because
Right.
gee, Doris is right. you look at that thing and it's just too much, especially a new person coming on that's
Right.
starting at ground zero on everything. you
Right.
know?
Yeah.
But
That's
I would
what I
be
was thinking. Yeah, because the
Yeah.
framework, so that, okay, you can't get to the plan until you start to build those relationships.
Right.
But you can't make the relationships with nothing to, like, why are you here?
Right.
So it's very tricky, isn't it?
Yeah, it is. It is. And we do more of a logic model. We broke it down to a logic
Mhm.
model, and it's been successful. And again, we're doing our strategic plan again the first of the year, but revisiting that. But you got to break it down. It's Doris hit it, Dina hit it. It's overwhelming. And it like I said, to be honest with you, I just put it aside. I went, thank you. I know I need to do this, but we just kind of went our own route. And it's okay. There's still pieces out of there I still have pulled, but pieces
Right.
that I think are very useful.
Right.
It's just kind of breaking it down a little bit. So
Well, and I think it's overwhelming because it's like, at least with the grantees that did it, they had this limited period of time to do it, and they were kind of going through it. And I think it's much more fluid and messy than that. And for those states that didn't have, that they cobbled together relationships in order to do the planning project, that didn't work very well.
Yeah.
Because, the relationships were new and they just jumped into this thing that seemed kind of onerous. And so it's not this linear thing or step by step thing. It's messy. So I think what you just said makes perfect sense to me. How do we capture it and make it really accessible and less frightening? And how do you do this so people start to get rewards right away?
Right.
So that you don't just go, oh, this was time wasted. And the
Well,
facilitator is one thing, but you have to have
Yes.
the right relationships together to even get to that.
Yes, and
point.
facilitator, what Dina and Doris are saying, you have to have a facilitator, outside facilitator, hands down. There's no way. Because again, you can't be impartial when you're going into that as like Ida or I or Jennifer. If we went in, you can't, and I even step back. I don't even really get involved because I don't want to put my own years of bias into that and to squelch something that's being resurfaced. I'm like, oh no, that didn't work before. I don't need to be saying that. I need to kind of take a back seat and just listen and offer if they ask for history, that kind of thing, because I don't, that's not what that's for, is to say, oh, that didn't work before.
Yeah.
I have to be very intentional to sit back and let the strategic planners, we usually have like 12 to 15 that come, our big partners, come in and really give their insight. And a lot of them are new, they have not been around. And so just kind of step back and listen. I bite through my tongue many times, but being intentional on that and to let them really express and take in ownership. So
that makes me think of something that we kind of covered a few years back, and that's setting up that paper trail, like succession planning, that you have the whole history there. So I've always thought about writing down the history for succession planning, but it's also really important for what you're talking about, because you don't want to impose everything that you think, and you want to be open to new ideas, but also they need the history and expertise. You have wisdom, as well as opinions. You have real wisdom. So how do you make that accessible without kind of overpowering everybody else with?
Right.
Yeah.
Yeah, and I want to just chime in and add, because again, Nadine and we're in contact daily too. And I think even though you may not intend to, sway one way or another, there's real benefit to having someone to walk you through the process, to allow it to really be even more beneficial. Because even it's like so many different things, relying on someone to allow the team as a whole to, share and exchange the ideas and go through the process. So again, I think that's really important. And even if some states have difficulty, like you said, with funding that, really thinking outside the box, maybe there is a coalition partner, they know someone that knows someone. And so it is also, you know, if funds aren't available to pay someone, really thinking, well, maybe there's that expertise, you just need to make the connection to help with that process.
And you know, we've talked about forming partnerships with universities in lots of different ways. And one possible way for us to find a facilitator is through, you know, a doctoral student who is specializing in evaluation and, you know, or a master's student needs a thesis or a doctoral project. I mean, you know, you can think outside of the box sometimes. And sometimes they're good at finding money. Sometimes the university has money for community outreach projects. So we agree, a facilitator is a good idea. So one thing we could talk about in a webinar is how to find and hire a facilitator and how to use them, like exactly what you need from them.
Susan, this is Marilyn. Could I make a comment?
Please.
I'd like to go back to whomever, maybe it was you, who said, what are we sustaining?
That was Doris.
Because we are coming to the conclusion next year of our third 3-year lifespan respite grant. And our Commission on Aging has done a remarkable job in developing consumer-directed respite and rolling it out around the state through the area agencies on aging. And in the 2022 legislative session, received a huge amount of money in state general funds that they are using to support navigation and consumer-directed respite. But with the ending of that 3-year grant, the funding for our coalition is gone. And so we're sustaining the respite services, maybe not lifespan,
Right.
but we're sustaining the respite services. But the coalition, which has gained over the last 7 or 8 years, a remarkable voice, a remarkable reputation for collaboration and advocacy, and trying to be a silo buster. We don't have the funds to continue.
Ugh.
We had a meeting earlier this year where the director of one of our independent living centers was on the meeting, and he just spontaneously started talking about the value of the Caregiver Alliance in Idaho and how it fills that gap that we were talking about in terms of representing the voice of caregivers that often is invisible. And so the timing is good for this because a couple of my colleagues and I are dusting off our the second part of our ICA strategic plan and kind of updating it and looking at the deliverables for the last couple of years. We're doing that this afternoon. But that whole issue of what are you sustaining? It's one thing to sustain respite programs or respite services, because that's a lot more concrete for policymakers to see, to see the product. The coalition, it's a lot more abstract in terms of what we do to bring people and organizations together around the core concerns of caregivers and advocate for that. And so it's just, that's kind of what we're struggling with here. We did not, I will confess, did not utilize the toolkit, but I'm going to go in and look at the self-assessment piece at this juncture. It's kind of, we're kind of putting the caboose where the engine should be, but and just kind of take a look at that before we launch into our meeting this afternoon. But that's an issue for us, is the grants have been very successful in producing products and sustainability for the services, but not for the coalition.
Right, right. So, well, one thing I'd say, just if you look at the title on the screen, I put repairing and reviving, because you're not the first state that's dealt with this.
Right.
So we'll all learn a lot from you as you go through this, but yeah, so the coalition is less tangible to people than like a government agency with an office and a person and, you know, an org chart. And yeah, I open this up. This is such an important thing, but how do you make the importance of what you do as a coalition, collaboration, the advocacy, the information exchange? I mean, it's all critical, right? But how do you make people see that in a way that they want to fund it?
Right, exactly.
So at the conference, Lori Stelbaum talked about the fact that there are 15 organizations that are coming to the end of their grants. We are one of them, at least our 3-year grant. But there is more lifespan respite money coming out. And she's asked for 10 million. We're at 8.1 now, but she's asking for 10. I don't know if you want to talk about this, Jill, but
well, whereas the National Respite Coalition is asking for 14 million, which is the amount the president has requested in his budget for the last 2 years. And it's not, I don't think Lori said that they were asking for 10.
Oh, I thought she did.
They can't really request.
Oh, okay.
Well, I mean, there is a budget request.
Maybe she said she's hoping for 10.
Yeah, she's hoping for that. As always, we're working really hard on the 14. But the way it's looking right now is we're going to have a continuing resolution for the next year, because it's an election year that will probably fund us at current levels for the next year. But we never give up hope. And then for the last few years, we've gotten 1 million more every year with all of your help as a grassroots network, you know, reaching out to your members of Congress and helping us keep the issue alive in Congress. We have been able to inch it up slightly.
But hope is not lost, is all I'm trying to say to Marilyn. There's still forthcoming opportunities.
Right, and we've been exploring that with our state Medicaid agency in terms of a different grantee than Idaho's had to this point. And those conversations, or our state independent living council. So those conversations are ongoing.
Well, just a quick survey among all of you, how are your state coalitions funded and supported? What are the funding sources for state coalitions?
Well, I'll just take this moment to say I just landed an AmeriCorps grant for $3 million. So I'm pretty excited. And it's
holy cow.
I know, it's nuts. and it's to focus on respite, but also building the workforce. So the idea is to recruit and match these volunteers with lots of organizations within the target area, and then support them in moving forward into the workforce as some kind of in the respite workforce. So it's a daunting project. Maybe as daunting as that toolkit, but we'll figure it out. And there you go. It's pretty exciting.
Our coalition is principally funded by our lifespan respite grant, but we also receive and have for the last 3 years a chunk of money from our Money Follows the Person program within Medicaid to demonstrate a navigator system. And
Right.
Dean is well aware of that. We've talked a lot about that. We're using the TCare platform for that. So but that's given us money to do navigation that we wouldn't otherwise have had.
And you did some nice pilot studies of that, as I recall.
Mhm.
And
Thank
so
you.
with that, will that money continue? Marilyn, do you think?
You know, it's been a year-to-year thing. It was intended to be a 2-year demonstration.
Right.
And we're now in our 3rd year, and it looks like there'll be a 4th, but we never know. It depends on what funds Medicaid has to put in this pot. We're
So
finding
yeah.
it's very well received, and we're hoping that it continue, but we also recognize that it is indeed a demonstration.
Right. So you need some other funders who recognize the importance of what you're doing.
Exactly.
And one of the positive things that I hear you saying is that you're producing something that's useful to people, so that the worth of the coalition is apparent. It's
And
not.
we're going to have a meeting next Friday with Doris and Dina to talk about this a little further.
Great. We'd
Okay,
love to hear
okay.
that.
We finally got it, Doris.
Oh, did we? Is it on the books? I haven't looked.
Doris
at
just
that.
accepts everything.
It's on Dina's calendar.
It should be on Doris's too.
Okay, I look forward to it. We also received funding from HRSA through University of Rochester, and that piece of the grant really focuses on caregiver education. So, I mean, we do have a couple of focuses. So if one goes away, we do have, you know, it's kind of like you got to layer it like your garden, like something else pops up.
Yeah.
I will say too, I guess, you know, yeah, you're always wanting to explore, you know, new funding opportunities. But another thing that I think was really important when we were going through the toolkit and looking at specifically at the financing module was just kind of thinking too, things we could try to explore and put into place that could help sustain, you know, from a revenue standpoint. And I mean, that was really, I think, Doris, I don't know if you agree, but I think that was kind of what convinced Lifespan to be agreeable to trying to be the FI for the voucher model, because, you know, I kind of made the pitch to Anne Marie Cook of saying, like, you know, if we're going to allow our network now under, you know, our AAA network under our National Family Caregiver Support Program to offer vouchers, because that's going to be brand new for them under that program model. If the infrastructure is already built with the coalition, that gives them a natural place to go, right, for processing those vouchers under other federal funds for respite care, you know. So you know, they've been operating the program now since January, but we're getting ready to update our program standards to allow for that within the AAAs. And we've been kind of highlighting the fact, I mean, we can't force them to do business with the coalition, but we're kind of saying, you know, the coalition's been doing this now. You know, you might want to explore working with them, and they can help you with processing vouchers if you would like to do that with your Title III funds. So I guess just thinking about it from that, you know, angle too, is if there's things that are happening in, you know, other program areas that you can kind of tie to the coalition's work. And same thing with what we're piloting now with this Caregiver Wellness and Respite Center, you know, just conceptually of having this hub and spokes model that if it's effective, you know, we can hopefully replicate it in other parts of the state. And there might be, you know, community organizations within that region that might have interest in helping to fund something like that. So
you're really looking for cross connections.
All the time.
Yeah. And I hear Nadine talk about that so often too.
And I know we're almost at time, but I'm going to say, because you're asking, for me, the whole membership piece, I struggle with that. I still struggle with that. It's part of our sustainability plan. But how coalitions do that, and I know from lots of conversations that it looks different for every single coalition, but boy, that I just keep spinning my wheels for years now on that one.
Okay, let's put a pin in that one and talk about that next month too. And what that has to do, how that contributes to sustainability and these cross connections. And okay, wow, thank you. You're all so smart and so deeply knowledgeable. It's just really great. I'm going to re-listen to this a few times and try and glean from that some productive avenues to pursue with the larger network. But, and then I've missed report-ins this week. I love hearing you all reporting what you're doing. So we'll go back to that format next month where where we have report-ins of what you're doing, and I'll just do a little summary of today's meeting, and maybe we can keep working on this until we come up with a plan for sharing the wealth, demystifying sustainability for the larger network. Thank you so much.
Thank
all
you,
of
Susan. As always, your leadership is appreciated.
Well, thanks. And I'm only here because of Jill and her leadership. So
There you go.
it kind of works, doesn't it?
It does.
Okay, my dears.
Have a great
Thank you.
Go do good work.
Take good care.
Bye,
Yeah, you too.
everyone.